Hello, my name is Zachary Harrison. I'm talking about competency 3.3, where we consider the socioeconomic impact of the delivery of healthcare. I mustache you to consider it. Oh, mustache joke. So, in any healthcare system, even single payer systems, the cost of healthcare must be considered. In the American system, where few price controls exist and where people are generally reliant on private insurance, which may or may not cover all their treatments, the cost is even more relevant. I think we've all probably seen or at least heard of Breaking Bad, where someone turned to selling meth to cover their cancer treatments. So ideally, we would not have patients doing that. So less known to the public than the sort of broad spectrum idea of the high cost of American healthcare is the term financial toxicity. It describes the fiscal burden of having a severe medical condition. It includes not just the cost of treatments, which may or may not be partially covered by an insurance carrier, but often there is some coverage available, but other things that are not covered at all, like the lost wages from being too sick to work, the cost of traveling to see specialists, which can involve, for some people, very specialized transport, like an ambulance or an ambulette, and also having a loved one or a friend or a family member take off time from their work to assist you, because it may not just be a one-person journey. In essence, it is a tax on the very people who can least afford to pay it. So what can we do about it? Ideally, we would have sort of a wholesale change to our medical system. This conglomeration, as I said, of sort of private insurance, government insurance, out-of-pocket costs is terribly inefficient. But short of that happening anytime soon, we have to do this more on an individual level, which is frustrating, but it is reality. So for registered nurses, there's actually a role known as a financial navigator. You often see them in settings like cancer centers, where patients are going to be facing a long treatment course that can be many months or even years. So basically what happens is these financial navigators will do an intake when the patient starts or is getting ready to start treatment, whereby they sort of go through see what kind of insurance coverage they have, what options may be available in terms of applying for state assistance, what sort of family or loved ones are available to help transport them and be a resource for them there. It's a sort of wonderful system that we use to deal with a terrible system. So definitely the silver lining to a storm cloud there, but it is something that registered nurses can do. You don't need any extra degrees or anything. It's just sort of on-the-job training. And it's a way to help people avoid sort of the worst possible outcomes financially while they're trying to avoid the worst possible outcomes for their health. Another way that nurses, specifically advanced practice nurses like CRNAs and NPs that have prescribing power, can take action is by sort of assessing the cost of treatment before ordering it. For example, medications, if you're ordering a generic medication for, let's say, anticoagulation, it's probably going to be more affordable than one that's still patented, and often for a very little difference in function. So there can be a very marginal gain in quality that is, wonderful. We love to give patients the best possible treatment, but if they can't afford it and thus are not going to take the medication, it's really better to prescribe something that they're likely to take rather than one that they are unlikely to take. Another option to consider is when you're ordering scans. So the frustrating part that anyone who has worked in medicine can tell you is that your insurance often has Byzantine systems for deciding what gets covered and where. So a CT or an MRI that you want for, let's say, a patient with a brain tumor, it may be covered better in terms of percentage reimbursed at a facility that's not your own, and that's incredibly frustrating, but it is a reality. So if you have an understanding of where the patient's coverage works best, sort of in-network versus out-of-network, that can be tremendously helpful as a way to alleviate some financial burden. So it is unfortunately a terrible system, but there are people, specifically nurses, both registered and advanced practice, that can take steps to ameliorate it for patients. Thank you.